Hey, chiropractors, welcome to Modern Chiropractic Mastery with your host, Dr. Kevin Christie, where we discuss the latest in marketing, business, and professional growth with some of the leading experts in the industry.
Welcome to another episode of Modern Chiropractic Mastery. This is your host, Dr. Kevin Christie, and today I'm going to bring you a solo episode, and I'm going to talk about some of the different barriers that you may be putting up in your clinic, sometimes intentionally and sometimes not, or sometimes you're willing to have the exchange of what that may be. But there are certain things that are barriers for patients. And we had once done a whole coaching lesson. I think we did it on the mastermind as well, where we talked about the friction free patient experience and everything from new patients to existing patients to inactive patients. What would it look like theoretically to have a friction free patient experience? You know, there's things like having online scheduling, having the phones answered quickly and getting back to them, being able to schedule new patients within 48 hours, making sure your social media is monitored for direct messages, online paperwork. We kind of ran through this whole thing, right? Just, short wait times, treatment plan handouts and Chiro up reports. Having payments stored on file. There's a lot of things that could really help smooth out that process. Because frankly, in healthcare, it's very, very friction full, as we can imagine. But then when you design your practice and some of your systems and processes and how you do things, some of them can be barriers, and that's not uncommon. It's not uncommon, but again, we're going to roll through these, and some of them you're going to be okay with, and there's an exchange to that. And we've done this in our clinic, and I'll outline some of that, right? But some of the barriers, I'll just kind of go down a list and briefly chat about it. Obviously, if you're out of network with insurances, that's going to be a barrier for a lot of people. All right. So if you're in network with every insurance there possibly is, you've removed that barrier and you are more than likely the most affordable option they have. And so you've, for the most part, taking a lot of the finances out of it, right? You're in network with all the insurances because frankly, when you're out of network, you might get 10 people that want to be new patients. And sometimes you don't even know that they don't become a patient of yours because of this. But let's say you have 10 call and, they inquire about being, a contracted provider with their insurance and you're not. And, maybe 7 of them become new patients or 6 of them do. And so you've lost 3 or 4 because of that. Whereas if you were in network with insurance, they would have more than likely scheduled. Those are the ones that call. There's quite a few that might find you online, Google or a friend refers, and the first thing they do is look to see if you're in network with insurance, and you're not, so they don't even bother calling. So those are kind of the silent ones you lose, right? So, and I'm not, saying it's right or wrong. My clinic is out of network, and I knew that I used to be in network. I went out of network. I knew that was going to be a barrier for some, and I've lived it, and we've been okay with it. But it is a barrier, and I think we all know that. That's one of the bigger barriers. Okay? Another barrier is, and we recently did this, but for a long time we were out of network with insurances, but we billed the out of network insurance for the patient. And we no longer do that. I think it was a couple years ago we stopped doing that. So we don't bill the out of network insurance. Now we'll give them a super bill if they request, and they can submit it. But we took that layer out. Okay, that one didn't really seem to bother anybody there, right? But that is another barrier, obviously. Your clinic hours, right? Are your clinic hours designed more for you than for what your patients are, right? If you might work in a particular area where if you had, 7 a.m. start hours a few days a week, that would be filled early and you'd see more people, but you're not a morning person. And so you start at, I don't know, 9 a.m. It's fine, right? You could be in an area where people won't need appointments to 7 p.m., but you don't want to get home too late. And again, totally fine. But have you developed clinic hours that are more conducive to patients, or are your clinic hours putting up barriers, and how much of that can you sustain? Some people do Saturday morning hours. That's opens up a whole world of visits for in a particular month, right? You get people that might see 10 people on a Saturday, and you do that 4 times a month. That's 40 appointments. And how many of those would have come in on Friday if you didn't have Saturday? Like, there's going to be a certain amount that would have come in anyway, and a certain amount that wouldn't. You got to figure that out. But clinic hours can be a barrier. Okay? Um, we talked about being out of network or in network, and so your cash rates. Some people, the cash rates are too high, and that's a barrier. I'm all for not being commoditized. I'm all for, as charging what you are worth. But there's a lot that goes into being able to have high cash rates and enough people seeing the value and being willing to pay that, and your schedule being close to full for the week. There's this kind of thing going on where a lot of rehab chiros are charging a lot of money per hour, like $400 or $500 an hour, which you know I love when people can do that. I've had James Spencer on my podcast some years ago. He's someone that built up to that, but he's someone that's built up quite an expertise to get there. Sometimes people are putting the cart before the horse, and the cash rates are not indicative of what the public perception is of their particular skill set. And so, yeah, the patients they are getting are paying a lot, but they only see 12 people in a week, and it's not enough money to build a clinic and a team there. And so you have to, you have to evaluate that. Are your cash rates too high for the time being? Do you need to build up your expertise over some time? Do you have to be in high demand? Like, do you have to become James Spencer or Greg Rose or, Brett Winchester, something like that, where, yeah, people will pay it because they see the value. But I love higher cash rates, but it can be a barrier for some patients, right? Chiropractors, if your website traffic or Google Maps visibility has felt a little unpredictable lately, you're not imagining it. A lot is changing behind the scenes. AI is reshaping how search results show up. Competition in the map pack is getting tougher, and simply ranking well does not always translate into new patients. That's why Propel Marketing and Design is hosting a free chiropractic SEO workshop. You'll learn what's actually changing with Google Maps, how AI is impacting the way patients find and choose clinics, and what small, realistic updates you can make this year to stay visible and competitive. This is not a high-level talk or a bunch of jargon. It's a practical step-by-step workshop built for busy clinic owners who want clear direction and next steps they can actually implement. Save your spot for free at propelyourcompany.com/MCM-SCO-workshop-2026. And we'll see you there. Now, your patient schedule availability. Like, I treat patients twice a week. That's a little bit of a barrier. There's no doubt about it. And so it's not necessarily our clinic hours are a barrier. It's just my particular patient schedule availability. Or are you so busy that a patient calls and you can't see him for 2 weeks? Or you're trying to reschedule a patient, they come in on Monday and you got to get them in another time this week, and your patient, you're already filled up. And so there's a barrier, or you just have so few availabilities on your schedule that the patient's like, yeah, I'd come in one more time this week for my care, but you only have Thursday at 5 PM available, and I can't do that. And so now they're missing appointments, right? And so your availability can be a barrier as well. I think oftentimes the 30 and 60-minute appointments is a barrier. Time is a barrier. There's again, this perception that time equals results. And in some cases it does. Some types of patients it does. If you spend too little time, it impacts it for sure. But if you polled 100 people, and if the results were the same, would they rather come in for 20 minutes or 30 minutes or 60 minutes? The vast majority would like to come in for 20 to 30 minutes. Now, I think we've equated people being okay with 60-minute appointments with physical therapy, but a lot of those physical therapy patients are post-surgical, and that's an event in their life that they know they have to take serious for 8 weeks or whatever, right? 3 months. and they'll be done. They, had ACL reconstruction. But a lot of people don't want to spend 60 minutes twice a week at a chiropractor's office. There's some that do for sure. It's a select audience. But time can be a barrier. So keep that in mind. Too much time can be a barrier. Compliance. I have a saying that compliance is the thief of joy. And having your office be compliant in everything we have to be compliant in, HIPAA and all the things and billing and all that can be challenging, right? Um, Avoiding dual fee schedules but being able to bill cash patient this, but the insurance that. We've recently implemented Chiro Health USA for that reason, because even though we're cash based, we do have auto and we have Medicare, and we just want to make sure we're compliant. So we use Chiro Armor for our compliance training and making sure we're compliant. And then we implemented CHUSA for that. But getting people to sign up for CHUSA, there's a lot of communication that goes around that. And, and you got to make sure it doesn't become a barrier. But having your clinic fully compliant, it can be a barrier for some, right? And that is a reality. But so far, so good on implementing CHUSA, which has been cool. And it's allowed us to feel good about how we're billing our personal injury and our cash and doing everything compliant. And overall, patients have been very accepting of that, right? Next is not having online scheduling. That is a barrier for some people. I don't think it's a huge one, but it is a barrier. I'm halfway there. I got a lot of barriers. So there's a lot of barriers here. And again, the point of this is not to say you shouldn't be doing some of these or you shouldn't have some of these. Just letting you know that they can be a barrier. And what my recommendation is, I'll kind of give a little halftime here, a little halftime pep rally or halftime speech, is to overcome some of these barriers. You need to layer on really good communication. You as the doctor and your team has to have really good communication with patients, right? If you're adding over with insurances, there has to be good communication on why it's still valuable for the patient to come in and pay cash rates. If you're, trying to sell cash packages because you're a cash practice, you have to have good communication around that. If you're implementing Chiro Health USA, you have to have good communication around that. And if you have high cash rates, you better have good communication with the patient and report of findings and treatment planning and visit to visit and all that type of stuff. You can overcome some of these with a world-class experience for the patient. And that world-class experience is going to be your clinical chops. You got to have that, which is, again, I think was part of the struggle with some of the early DCs trying to do certain things like huge cash rates and stuff like that, is because they don't, frankly, they're not a lot of times great enough clinically to warrant that yet. To get there, you'll get there, but it's just not yet. So do you have to have that world-class experience? Your clinical chops, you gotta be good. You gotta be great, right? Your communication with the patient has to be really good. Your communication with the team and the team communication with the patient has to be really good. Okay? So you got to have a nice office and you got to have all those things to be able to warrant some of this. You have to be in demand because they have options. When you put up a lot of barriers, there's other options. If you're in high demand or your clinic is, people will accept the barriers because they know the value's there. Let's take a short break from today's episode to tell you about the best decision I've made in my clinic in the last 10 years, and that has been adding shockwave therapy to our clinic. The outcomes have been really impressive. Certain conditions we were struggling with in the past, we're now seeing results with the shockwave therapy for that. And second of all, the ROI has been really good. When you make a big investment in something, you want to see a return, and we're seeing that return in clinical outcomes and in our investment, and that's been really nice to see. I chose Keenest Medical for 4 reasons. One is the technology is top notch. You have to have great technology. There's a lot out there that isn't quite up to snuff. The second thing is they have a really good clinical training. They have an exclusive partnership with Academy of Shockwave Excellence so that you can become clinically proficient in shockwave. You do need to get skilled at it. I think that's a big differentiator between practices that are getting great results and seeing the ROI is they have a great clinical aspect to that as well. So you want to get trained appropriately.
Third is they have in-house service team for all of your technical support, which is key when you're investing in a machine like this. And then lastly, they have a very in-depth marketing and business support for you so that you can launch this into your practice effectively, that you can get that ROI on it, that you can get the clinical outcomes. And they also have really good financing options if you need that. So go to kinasmedical.com, KINAS medical.com, mention MCM podcast and receive a free Shockwave in practice book with a purchase of a unit. So that's kinasmedical.com, KINAS medical.com, and mention MCM podcast.
Another barrier is limited social media and Google presence. Okay. If people can't find you, that is a barrier. If patients are being sold packages or payment plans, which I'm for, reasonable packages, nothing crazy. We sell very reasonable treatment packages and payment plans. That you need to have communication around that. But some chiropractors where it's almost like you have to buy a package or payment plan. That can be a barrier. Requiring credit card or deposit on file for new patients. I have some clinics that do this and they actually do well with it and it works well for them. They're in high demand. They've got great clinics. They're weeding out the no-show. Nothing worse than the patient that doesn't show up or late cancels. So, but that is a barrier. There's going to be some people that aren't going to do it, but that is to offset that. Late cancellation fee. That can frustrate some people, but it can also weed out the flakes, which I totally get. But again, just keep in mind that if you do that, it'll be a barrier for some people. But it can definitely, if you do this right, if you work through this and you build up your expertise and you become high demand and you do a great job and you have a remarkable experience, you can start adding some of these things and you can really curate the patient base you want that you like. You like 90% of your patients. So like a lot of chiropractors hate half their patient base. You get frustrated. But if you do a great job, you can do this and you can really cultivate the patient base you want and use some of these barriers to do that. All right. Poor communication capabilities with your office, right? Patients can't ever get a hold of you and leave messages and they don't get called back. There's not a way, like maybe there's no two-way texting capabilities. There's no online scheduling. Maybe the email you offer your email address, your clinic email address on your website or whatever, but you don't answer the emails. Maybe you do a lot of Instagram stuff, but no one's monitoring your direct messages and people are messaging you through there for appointments. So those are all examples of barriers of poor communication capabilities with your office, right? Bad location, parking, no parking. That can be a barrier for some. Some places of business, if I know that parking's impossible or it's hard to get to, I don't even go. Check that out. Long wait times, right? Do people have to wait in your waiting room for too long? That's a barrier for a lot of people. It's not too bad for chiropractors in general, but it is a barrier. Do you offer very limited treatment options, right? You only offer maybe one or two things. That's going to be a barrier for some, right? But it can also be great. Like if you're just world class at palpation and adjusting, and that's what you offer, and you do it in an evidence-based way, you'll probably be fine. You'll be really fine. But there's gonna be some patients that are looking for more. That's fine. Maybe you have a referral system for, if they're looking for rehab, you send them to a good rehab chiro or PT. If they're looking for dry needling, you send them to dry needling. If they're looking for shockwave, you have people around in your town that you referred to. Right? Unwelcoming, dirty, outdated, and uncomfortable waiting treatment rooms. Right? Just not a good environment. That's a barrier. Okay? Maybe it's an unfriendly, rushed, or unprofessional front desk or support staff. That is a barrier. You want to get that fixed. Lengthy or intimidating new patient paperwork and initial exam without clear explanations. Something that we keep on looking at. We have online paperwork and we got a fair amount of it. It's, again, when you become compliant, it adds things for them to sign. So we audit that every so often. Maybe recommended high visit frequency. could feel overwhelming or salesy, right? Or obviously long duration. That's where, if you're trying to do 6-month care plans, it takes such a high level of sales to do that because you're overcoming massive barriers to that and you have to sell, right? Like the higher the barriers in certain cases, whether it's money or duration of care, it's going to take more sales to do that, right? So those are my list of barriers that you want to look at when you're teasing out what your patient experience is and what your system and processes are. Think about like the joint, right? What I would say that if I had to sum up the business model for the joint is they've removed every barrier possible, right? And even though they're not in network insurances, they're so cheap that they're actually cheaper than most people who copay. So they're like, we're not going to do the insurance model, but we're going to make it cheaper than insurance. And so they've literally removed every barrier, right? I've talked to people with the joint. They only pick certain locations where they'll open up a joint. There's got to be a certain amount of traffic. It's got to be easy to get to, plenty of parking, nice space. You can walk in and get adjusted. It's super cheap. It's just the easiest thing in the world. Not saying it's good, but you can tell their business model was to knock down all the barriers. And walking in and being able to get adjusted whenever you want, that's a big barrier for some people, right? So just understand that. And when you lay out some of these things that we talked about today, is it a barrier that your clinic can overcome? Do you have too many barriers in this stage of your clinic growth, right? A lot of times practices add barriers as they go, and that works out well. That's what we essentially have done. We're 16 years into this particular practice, been practicing for 21, and it was a slow addition of barriers and overcoming one and adding the next, overcoming one and adding the next. Sometimes adding one and say, you know what, it's a little bit too big of a barrier. Let's remove that. And see how it goes for you. So I hope that was helpful. One of the things we try to do with our clients is make sure they have a great patient experience, friction-free as much as possible. And if they're going to add barriers or do we need to remove barriers, we help work through some of the strategy around that. So I hope it was helpful. Do an audit of yourself. Again, a lot of these I said, I'm not saying don't do, just understand that it can be a barrier to some patients or a lot of patients, and you got to know what you're getting into.
I hope you enjoyed this week's episode. And if you want to make the shift from busy, broke, and broken to time-free and cash confident, or you just want to continue with the exponential growth, check us out at modernchiropracticmarketing.com. Look at the MCM Mastery tab, watch the short video on there, and check out what we are doing now for evidence-informed chiropractors. We are equal parts coaching and marketing done for you. Yes, you shoot some videos, we help you with campaign strategies and ideas and really become a thought leader in your community. You shoot those videos, you send them to us, we produce, edit, and brand them to you. Then we distribute them through all of your channels. We also take them and we turn it into one good blog per month. And every other month, we have Darcy Sullivan producing a robust blog with a topic that you pick from her database to help with your SEO. So we essentially become your content marketing agency to make sure your practice is always having ethical, elegant content marketing to help grow your practice. On the coaching side, we also help you with everything from marketing ideas to business, communications, finances, anything practice growth, and really try to help prevent you from being stuck on that island. And we hold you accountable. We have a great group of doctors that are just doing amazing things. And we look forward to help you out to take that next step in your practice. So again, check us out at modernchiropracticmarketing.com and learn more.